Hello, everybody. So when people come on, I'll usually see it, Molly. Okay. Yeah. All right, so welcome. We're glad that you're all here, all right? Why do I do these workshops? Selfishly, I do them because if I have to be talking about all this stuff, that means I need to be doing it too. Okay, so that's a selfish reason. And we're all here because we have a lot of things in common. We have brains in common, nervous systems in common, spines. Obviously, we're interested in healthcare, or we wouldn't be here. So we have a lot of commonality that exists above us. So we only have a half an hour, and I promise that half an hour that hopefully it'll be beneficial to you. And when you leave here tonight, you'll say, you know what, I'm glad I spent a half an hour at Dr. Berry's office tonight, right? So you got to open up your hearts and your mind to receive information. Typically, when people give information, hopefully it's of value. And I hope that you'll feel that there was value here coming tonight. So our talk for the evening was going to be about vital needs. Vital needs, vitality. Where do we get vitality from? Do you know that word, Maya?
Important?
Oh, that's a good one. Vital, right? Something that's important. Okay. So I have a triangle up here, and I want you all to think a little bit about that triangle. So if you were on a desert island, what would maybe be on the bottom of the triangle that you need? Look at my marker. If we had something on the bottom of the triangle. I'm gonna put my marker, babe.
Water.
Water, okay. Who said food? Ooh, food, all right. So let's put food down here. These are the 4 vital elements that we need for the body. What's next? Water. Oxygen?
Yeah.
Oxygen. What's at the tippity top?
We need shelter.
Warm. What's the most important thing?
Love.
Maya, do you know this one? Not yet. You'll know it next time around when you come to class. What's that word?
Energy.
Energy. Electrical what? Current. What gives us electrical current?
Brain.
Our brain. Okay. Remember, you know, when the Boston Marathon happened and there was a bombing and the emergency people came to help people, were they passing out food to people? No. Okay. Maybe they passed out some water. Okay. Were they looking to see who needed oxygen and who needed emergency care? Okay. So they're looking for spinal cord injuries, brain injuries. Okay, that's the highest thing there. So guess what? In a chiropractic office, every single adjustment, am I passing out food? Am I passing out water? Are we passing out oxygen? No. Okay. We're stimulating the brain. I haven't done it yet, but the brain researcher, one of them, she's out of Australia. And I just got a pod from her. I got to listen to it for 2 hours about how to communicate better to the public that chiropractic is really about stimulating brain current. Isn't that cool?
That is cool.
Does the general populace know that? No. Okay. So how do we do it with the kids a lot of times? We show this, it's just a circuit, right? So if we all hold hands, Faith, you gotta get involved too. Everybody has to hold hands. It's good for people to see this, okay? When your brain is working properly, we chiropractors use the analogy of the safety pin cycle. So this is a big safety pin,
Huge.
okay? It's huge. This is gonna be my weapon if I ever need one, okay, in this office. Here we go. So if the safety pin is open and we have a baby with a diaper, well, we might probably have a problem, right? Or it does hurt if that little pin prick gets us. But we're gonna pretend that this is the brain. And your brain sends messages out all day long and it sends them to different areas. So Maya, this message is going to your foot. Can you tap your foot for me? There you go. And then once it gets there, it has to go back up to the brain to tell it. So this is a closed loop circuit, right? Do you think messages come out and they run to your heart? And once they get to the heart, they got to come back up. So we have descending and ascending messages. This is neurology 101. Okay, this is how the nervous system works. So if we open this, is the message going to get back to the brain? No. My job as a chiropractor is to find areas in the spine where this circuit has been upset. And when we make chiropractic adjustments, we help to reset that circuit, okay? So the body can work the way that it was designed to work. When the newborn comes out, that little baby, they come out with these 6 systems that are behind me over here, all in place. And they're supposed to be working good, okay? So you and I have those same 6 systems. When I check patients in the office, they hear me all the time. Is it a glandular, eliminative, nerve, digestive, muscular, or circulatory circuit? Okay. And then we also say, hello, Eric. We
Hi.
also
Sorry.
say, is your immune system. Because there's not a chart over there that says immune system. So Maya, do you remember where's your immune system? So you just picture sinuses, right? Okay, so sinuses could be our eliminative circuit, right? So our immune system plays a little role there. Where else is our immune system? Gut. There's a lot of talk in the last 10, 15 years, right? About gut health and how that affects the immune system. So we know that our digestive circuit is part of our immune system. What else is part of our immune system? Yep, your circulatory system, right? Okay, and we got the heart on here too, right? Then we have our white blood cells, lymph systems over here too. So we know lymph has a lot to do with our immune system. Where else is the immune system?
The brain.
Right, but we got a brain in every single picture here.
Okay.
Okay,
Your muscles?
muscles, yeah, so we got a muscles and heart here, there's immunity health there. Where else is the immune system?
All of them.
Is it all? I know the answer,
Get there.
Right. So really, truly, there's no such thing as an immune system. You'll hear the term a lot, okay? But it's really those individual 6 systems doing their job. That's what gives us immune health. It's an immune alliance. Okay. So do you think during COVID, it was important for people to get adjusted? Yeah, because you want that brain and that nervous system working as good as it could be. If you were to put a percentage on each one of these circuits, okay, each one of the zones from 100% to 0%. So that would bring us into electrical current here, right? Well, the lights are really bright right now, so let's say they're at 100%. If I shut these lights off, what percentage will they be at? 0, okay? So we flicker somewhere in between. So every one of these circuits has a 0 to 100%. If they're all zeros and the lights are off, what's that mean as far as a human being goes? They're dead, okay? So as long as there's juice going up here, we've got hope, right? So I know most of my patients come in, they walk in here, that's a good thing. So, and COVID was such a good example because people were really struggling. Some days they'd have their lungs and their sinuses were messed up. Another day, you know, their heart was palpitating crazy. Another day, their stomach was upset. Another day, you know, the glands were all sore. So like all the zones were kicked up with the COVID virus. And remember, it was a virus and it falls under a poison in the body. So the things that are gonna throw these circuits off is poisons, trauma, and stress. Okay? So when it comes to trauma, what's the first trauma that a human being can endure?
Childbirth.
Childbirth. Okay? So even the best, gentlest, I had home births, okay? Looking back, I think poor Paris, my oldest one, she had some difficulty getting out of that birth canal, you know? So it's so important that babies get checked, right? And if they're having cesarean sections, there's trauma because they gotta open up the mother, they gotta come in with their hands, they grab the neck and they pull the baby out. At least with a vaginal delivery, the mother's natural energy, the muscles, the uterine muscles are doing their job and they're pushing the baby out that way, okay? But I've seen trauma, I've been at births where I've seen trauma, you know, where it's a vaginal delivery too. So the bottom line is babies are supposed to come out healthy. And if they start having symptoms, then we have to think about the causes. What changed? Was there trauma? Was there a poison that happened to that child? Right? Or was there stress? So all of that can affect the nervous system. So each one of these is part of your nervous system. Where was I going? Trauma. Yeah, we talked about the baby. They say by the time children are 4 years old, that they've already fallen 4,000 times. Okay, so kids fall. And we had a gentleman I checked 2 days ago. He's only 28. He's had headaches for 10 years. And he's been struggling with anxiety and depression. Now, when I did the history on him, guess what? 4 good falls, head traumas under the age of 5. Stitches in the head, banged up. And I asked him, I said, you're going to all these neurologists. Didn't anybody ask about your trauma history? They don't ask. They don't look at cause and effect. Okay? So we want to look at causes and effects because that's, as a chiropractor, that's what we're thinking about. Well, wait a minute, what happened? The baby's supposed to come out great, right? And then all of a sudden, if they're getting ear infections or they're colicky, you have to question, is there pressure on that nervous system? And we're back to here. What is going on that maybe caused this to open? Okay. You can call the electrician, they're good about finding, you know, open circuits and they'll close them. But when it comes to human health, they're just not trained to do that, okay? So we like to talk in this office about the engagement spectrum. And it's this beautiful rainbow. Can you see that? So when patients first come in many times, they're totally not sure of what this office is about or what their health is about. And there could be, you know, some resistance a little bit because it's new information to them. And they could be self-serving because it's all about them, right? Okay, Faith gets to see this in the office. But eventually they become a little educated and things start to click and we start to get a little transformed and ultimately inspired. Okay. And Faith was with us this weekend. We went to a big event and, you know, we talked about our country as a whole and how the nation is sick. And there's a lot of drugs. And Europe doesn't use all the drugs that we're using. So there's a lot of brainwashing that goes on in the television. And people don't sometimes have alternatives. They don't know what the alternatives are. Okay. So the more that we can get educated and inspired, we can gently talk with somebody and say, hey, You know, there's things that you can do. Today I was with a medical doctor and I was getting checked because I got this cyst on my neck and I just wanted his advice. He was a plastic surgeon. And he was kind, open-minded, engaged with me, and a great guy, okay? And those are the types of doctors that we all need. Is somebody who's open-minded, who's willing to talk with us. We had a great chat about chiropractic. And so those are the people, I don't care if it's a vet doctor, you need them, the ones that are open-minded and will let you talk and have your opinions. You don't want closed-minded doctors and closed-minded vets, and there's another one I usually pick on. Vets, I feel like there's somebody else, dentist, okay? You want an open-minded dentist too. You know, when I had to stand in front of my guy and say, no fluoride. He looked at me and he said, well, why? He says, the American Dental Association. I says, Doc, I said, I can't have a normal conversation with you right now. I says, because I don't have all that data on my tongue, but with all the research and studying I've done, we're not doing it. So please, I made a decision. I love those words, right? I made a decision, okay? And as long as they respect you, then you get to have a good, nice relationship with these people, okay? But when you be disrespected and they get angry, that's not good, okay? All right, but I went on a side note, but somebody else needed to hear that. All right, so these are our 6 zones. Faith, any good stories in the office recently or something you heard from the seminar that intrigued you?
I've heard something about,
Go ahead.
while she's thinking.
No, go ahead.
If, that if you're not born by a cesarean, that you actually need your like heads, like, adjusted as a baby because it didn't get smushed.
If
Do you know
you're
what
not
I'm
born vaginally. is
Yeah,
what you
sorry,
mean.
I'm sorry,
Yeah.
yes.
Yeah, because what that does is when those cranial bones get like squished and everything,
Yeah,
it gets respiration going. And internally, the doctors who do SOT, sacral-occipital technique,
okay. I
they,
heard that.
they say that that's when the breathing mechanism and there's tension that can occur inside the spinal cord. So they really like people to have that happen. And then, so if it doesn't
Is there an
happen,
expiration date on that? Yeah.
well, if it doesn't happen, because it goes back to this, to all the different cranial bones.
Yeah,
Okay, so some people, you'll see some people's heads where maybe there's a peak or it's off, you know, maybe their frontal bones are sticking out more. You'll see that in adults. And those are the people that maybe had some type of birth trauma or they didn't get that mechanism going. So the cranial sacral people that do cranial work,
yeah,
that's kind of what they're designed to do. They may go up into the mouth and palpate the sphenoid bone that's in here.
yeah.
Yeah, so it has a lot to do with respiration and torque on the spinal cord. So I don't really do that too much in the office, Molly. I have a great deal of respect for it though. Does that kind of answer your question?
Yes.
Yeah. Did you come up with something? No. All right. We did a lot over the weekend.
We did do a lot over the weekend.
Yeah.
Where'd you guys go?
We were down in Providence and we were at a seminar with a bunch of docs. And we were just talking about how do we get the chiropractic message out to people? You know, because people don't know what we know. And these drug commercials, when you watch them, I have the TV on in my house. The drug commercials are crazy. And if you have young people that are watching them and then they start to believe that this is what I need to do,
Yeah.
okay? Because the schools are not educating us on health, on true healthcare. And really, what is true healthcare? We talked a little bit about the body here, because you do need to have food. But in our book, Raise the Dawn, and I always like to go back to this, there's 4 laws that govern the body. And one of them is nourishment, one is sanitation, one is relaxation, and one is, what am I forgetting? Movement. Okay, so we really have to be obeying those 4 laws of the body to help all this work properly. All right, And nobody's teaching us that. The schools aren't doing it anymore. They just teach the children about bad things and they frighten them. Okay, but true health is about eating fresh fruits and vegetables. Okay, every day. And getting exercise. And learning to quiet the brain down, because we can't have the brain going crazy thinking about negative things and, you know, we have to really work on being meditative and just kind of relaxing. We need good air, right? We need internal cleanliness. So food is on the body twice, is food involved. It's involved with nourishment and it's involved with cleanliness. Okay. And then movement, chiropractic is about moving the joints. Because once that spine gets changed, and if those vertebrae get stuck, they're gonna stop moving in that certain level. And what do you think happens to bone tissue when it's in the disc, when there's not fluid motion in there? What does it turn into? Arthritis. Okay, that's where arthritis comes from. It's a joint that's been hurt, and then nothing's done to help it, and if it stays stuck, as the time goes on, the body lays down, it goes into the arthritic process. So when we get somebody in who is in a state of some of those joints like that, we want to encourage movement, encourage good food, because you think the food plays a role? It does, okay? Diets that are really, really high in protein and they're not balanced. That excessive stuff is many times is gonna find itself in some of the weak joints. Okay? So our nutrition plays a really big role with the integrity of the bone structure and all of our charts behind us, right? Do you think food plays a role with your elimination? Yeah. Plays a role with your digestion. It plays a role with your circulation. So it plays a role with all of it. Where else are we going? Maya, you have any thoughts? Logan's awful quiet in the reception room out there. All right, so what's the bottom line? Who's gonna take care of us?
We do.
Ourselves. See, I always say to the children, Chris, when they come in, mom and dad are taking care of you right now. All right? But mom and dad have to teach them, start teaching them how to take care of themselves before they go off to college. Look at all these college kids. Some of them are idiots, aren't they? Okay, so they have to learn to take care of themselves. And it's really our responsibility to kind of teach them that they have to be self-responsible. Because if not, the doctors will let them all off the hook, okay? And somebody has to eventually say, hey, you have to take care of you. Okay. All right, where am I for time?
4 minutes.
4 minutes, 4 minutes off?
Yeah.
Oh, we're doing good.
6:56. Doing great,
Okay.
Dr. Mary.
All right. So I think my question to you is, who do you know that you can tell a little bit about this to? You don't have to answer me, but who in your life really needs some help? Because if they don't get it, they're gonna end up on drugs. Okay? Or surgeries. There's a lot of surgeries out there. Okay? And people really can be helped. Can children be helped? Yeah. You know, we see a lot of children. Years ago, I saw a lot of kids with ear infections. And today, they continue to put them on antibiotics. And for 25 years now, the research has shown you don't need antibiotics for an ear infection. So when you continue to put children on antibiotics, what do you think it does to their gut flora? It messes it up. Okay, so it's not fair to do that to the little ones. Okay, so again, who do you know that doesn't know what you know tonight? You're gonna share some information. What you heard tonight, are you going to hear that at your general practitioner's office? Nope. Are you gonna hear it at the cardiologist's office? No. You're gonna hear it from the orthopedic surgeon? No, sorry, guys. All right, you're all great people, all right? And as my husband always loves to say to me, Mary, that's how they're trained. And today I had a high-end emergency room nurse in here who's a great person, and she said to me, it's just their training. They haven't been trained otherwise. And so I guess as a chiropractor, I'm pretty fortunate because we've had a lot allowing to think, you know, to really think and to really think about causes and really how does the body work and how can we take care of ourselves. So who has a takeaway tonight?
The 6 systems make an immune alliance.
Ooh, that's a good one. That is a good one. Okay. Maya, you have something?
To like keep your body like to keep your body healthy and I only like one of like the only person, well not the only but I don't know how to explain, but like you can take care of yourself like by drinking water and
Eating what?
vegetables and fruits.
Yeah, very good. Okay. Eric, you have a takeaway?
Yeah, first of all, sorry for being late. I got detained, but
Okay, Eric, we like the fact you're here.
yeah, I mean it's the same thing that I come away with most of the time, which is I got to eat better.
You know, we all have to hear it.
Yeah.
I have to hear it. Okay? Do you have a takeaway, Molly?
That I'm gonna steal the alliance of the immune system, that it's an immune alliance, not an immune system.
Faith, you have a takeaway?
More movement, eating better.
Yep. Chris?
Now, I guess the one that I haven't heard potentially is you're gonna get your mind in the right space too.
Yep, yeah. You definitely have to work on that mind. It's very, very important. Okay? We talk a lot in here with the patients about worry and hope and fear and faith and disgust. You know, I had a woman in here recently and she said, I thought it just had to do with what I was eating. I says, no, if you're disgusted with work, okay, and you're chewing on something, it's gonna blow off that digestive circuit. If you're disgusted with politics and you're really angry, it's gonna blow off that digestive zone. So our thoughts play a huge role with how these circuits work. Okay, so thank you for saying that. All right, everybody have a good night. Thanks for coming on, we
Thank you.
appreciate it. Bye, Eric. Questions, anybody?
Can you explain concept therapy to Chris in 5 minutes or less?
Yeah, you know what? You know how I can do it? It's a chart.
Okay.
It's just 1,000 words, right?
Okay.